As many major U.S. cities lift pandemic restrictions, the country has surpassed 600,000 COVID deaths. It's a glaring reminder of what we've been through and that we are not out of the woods yet. The new book, Preventable, takes a look at how that number could have been much lower. The author of the book and former White House senior advisor for COVID response, Andy Slavitt, joins us now. So, Andy, thank you so much for joining us. You also have a really interesting podcast called In the Bubble, which you sort of took a break from when you went to work for the Biden administration. So I was listening to some older episodes of In the Bubble, particularly in sort of December and the early parts of January. And boy, things sounded so dire. You and your guests, talking about the way in which this country has failed to handle the pandemic properly, and what that says also about our ability to handle future pandemics or future pandemic-like problems. So now that we're several months forward from there, I am wondering how you feel about how this country has handled the pandemic, and do you believe that we have turned the corner, or, like I just said in the intro, we're not out of the woods yet?
It was good to be with you. I think what we've witnessed over the last 4 months or so has been one of the most historic transformations in our nation's health and well-being than we've seen. We've taken COVID from a very scary, uncontrollable pandemic that was killing thousands of people a day to something that is, I put in the category of a manageable challenge. Now, how we got there is certainly the hard work of many scientists and the great leadership and distribution of the Biden team, if I can say that without sounding like I'm patting myself on the back. But what I think we have to also look at is we look at pandemics and we look at our country are the things that, not the hard sciences, but the parts of the pandemic that got out of control, our politics, the way our society is so divided, the way that so much of the burden fell on low-income people and people of color during the pandemic. All those things are things that are wrong with our country during normal times. So we want to make sure that we address them, not just for the next pandemic, but I don't want kids to not have access to the internet or to need to go to school to get lunches. Now that we all know that this is an important part of our country and it's something we can fix.
Andy, we just threw up a quote there from the book, which is really intriguing. And you talk about in the book how our system of healthcare, the polarization that exists in our country, the inequity specifically as it relates to healthcare that exists for people in this country, depending on where you are, kind of job you have, the color of your skin, it all led to this situation that led to 600,000 and climbing deaths. But we've seen high death rates in other countries where they have very good medical healthcare systems in place. What was it specifically, having had a front row seat to the response in both the Trump administration and the Biden administration, that you saw sort of led us down this path?
Sure. Let me start with the Trump administration, because look, I think we ought to be fairly generous when it comes to mistakes that are made in the heat of the moment where it's a new pandemic, we don't have all the facts, but there are certain kinds of mistakes that are I think above and beyond that we should not be forgiving of. So one of the things that the Trump administration did for so long was just essentially deny the existence of the virus, deny the seriousness of the virus. We know that the President Trump was aware as early as January that we had a very significant problem and was unwilling to even acknowledge it. If he would have simply said, hey, we have a problem, instead of saying it's either not existent or making it seem smaller than it was, we would be in real trouble. One question the book asks is if the NBA hadn't had to cancel its season and the stock market hadn't gone down, it's not entirely clear the president would have ever addressed the situation, but it was the stock market that caused him to do it. The other thing that I think we can't look the other way on is the quashing of any dissent in the administration of experts. So anybody that disagreed with the president's narrative, which was that this thing is all overblown, was instantly silenced. one example of that in the book is that we had a Alex Azar, the head of Health and Human Services, was not even permitted to talk to the press for 45 days, the entire department, because he simply wanted to go on Fox and Friends and indicate that things could change rapidly. So imagine we're in a pandemic and our own health department isn't allowed to talk to the press or the public. That didn't happen in other countries.
But Andy, can I just ask you real quick, just to follow up on that, but you weren't privy to any of, you said that the former president of the United States, you don't believe that had the NBA not canceled their season or the stock market gone down, that he would have done anything about it. But you weren't privy to anything, like you didn't hear the president say that, you didn't hear one of his advisors say that, right? That's just you and your estimation of the situation as you saw it from your perspective.
Well, as the book lays out, I was talking to Jared Kushner and Debbie Birx, Anthony Fauci, and others in the administration throughout the book, and those conversations are in the book verbatim. And I will tell you that when the stock market went down, the president asked his team to arrange a press conference to pull a bunch of CEOs together and make a bunch of promises so that the stock market would go up. And they went out and they made 4 or 5 promises. The stock market went up. He bought the entire team, the headline newspaper, signed copy of the stock market going up, gave them to the press, gave them to everybody, and then absolutely none of the promises that were made were ever addressed, fulfilled, or even considered.
Will.
And from that point on, Trump, once the stock market was up, Trump considered the problem solved. And there's a lot of dialogue in the book inside the White House, which will reveal that.
Let me ask you about something else, because the book also looks at us, the American people, how we handle the pandemic. And certainly the way, partially the way the American people handled the pandemic is because it became very politicized, and some of it had to do with the messaging that was coming out of the White House. But then there was also this sort of general sense in some areas, some places, that, the government is overreaching, that why should we have to wear masks and all that sort of stuff. So can you sort of delve into that a little bit, the way we reacted to the pandemic and how that, became challenging?
Yeah, no, absolutely. I mean, there's a chapter in the book called The Room Service Pandemic, and what it basically lays out is it says out loud what a lot of people know, which is that for many, many people, the pandemic was not much of a burden. They were getting, if you had a big enough house, you were essentially had the enough money. People made a lot of money during the pandemic. There were people that could work from home, do deliveries, et cetera. And when it was clearer and clearer that people of color were dying disproportionately and people in nursing homes were dying disproportionately, there were people that reacted, like Dan Patrick, the lieutenant governor of Texas, fairly indifferently. And I think so simple things like wearing a mask, even if it would save other people's lives, even if you felt safe, was something that became a real big political battle. Also, I think our view towards expertise is one that's worth looking at. When you have a phenomenon like COVID-19, there's a lot that you can't tell from the naked eye. You can't see some asymptomatic spread. So if it exists, you have to basically trust and believe in scientists. And we had a whole industry of people working to discredit scientists, catch them saying things that turned out not to be true, therefore essentially suggesting that the scientists didn't know what they were talking about, and that they, sometimes a TV personality like Tucker Carlson, sometimes it could be anybody, were as much of an authority as anybody. And so, if you don't trust expertise, if you don't really see the burden that's happening to communities that are out of control, the people growing food in the Central Valley, people who were working in meatpacking plants, people in prisons, these people were dying in record numbers, and there was not a lot of focus on that.
Yeah, it has been interesting, Andy, that you have seen this rejection of science and embrace of pundits, essentially, but even politicians. And I don't mean that there haven't been historical figures in history, in our history, in other countries' histories that have been able to lead a country out of situations like this, whether it be a pandemic or a world war. But when you now even have people that suggest, for example, that a governor in one state is somehow a better person than a governor in another state because they didn't put in some of these restrictions into place and another governor did, and that somehow means that one person is not a smart person and the other one is. Or when you have people who will lecture me, who I went to college with, who I know couldn't pass English Lit in sophomore year, telling me that these are the medications that they know work for people who are infected with COVID. It does seem sort of disturbing. But do you think now, looking back, that there are any restrictions, with hindsight being 2020, that you believe may have been unnecessary?
Oh, certainly. Did we need to wash our groceries? Did we need to and wear masks outdoors? Those are all things that I think, in retrospect, if we had perfect knowledge, we wouldn't have done. But they pale in comparison to losing lives. I mean, so yeah, I'm sorry if people had to wear masks outdoors. I think that's unfortunate. We could have learned that lesson. But I'm a lot sorrier that a bunch of people will never be here to enjoy the rest of their lives. And so, there's something called the precautionary principle, which basically just says if you don't know for sure, take the more cautious approach. Now, the precautionary principle doesn't always apply, but when it's life or death, when people's moms, dads, brothers, sisters are dying, I'm okay with wearing a mask outdoors until we know better. Now that we know better, I think next time we will be that much smarter. But I think we should focus on what's matter, because once people are gone, it's the only thing you can't change. I can build back a business. I can build back a lot of things. I can't do anything about someone that's already died.
But Andy, just to make a finer point on it.
So your 19-year-old son, Zach, who's occasionally featured on your podcast, Zach's Facts, he is actually suffering from long-haul COVID. What are his symptoms? How is he doing?
Thanks for asking. Zach is a good kid, and he's 19, and he's, this is not getting in the way of his life. So I don't want anybody to think that he's, that this is, all that serious. Having said that, he has, he has his tachycardia, very fast heart rate. Occasionally, he has shortness of breath. He has oddly cold fingers and hands, which are probably a lack of circulation, and a couple of other things, and they tend to come and go. He's going to be fine, but I think it's important for me. The reason that he was okay for me to talk about this was because he wanted to make sure that kids would get vaccinated and not get this, because he's very sorry now, because he doesn't know when he's going to get rid of it. And for us as parents, your go-to move as a parent is to tell your kid everything's going to be all right, or to tell them when they ask you, Dad, when is this going to be over? To be able to give them an answer. And when you can't, it's not a great moment as a parent, because you really are a little bit of a loss. And so I think it's something for parents to consider when thinking about talking to their young people in their lives and in their families about getting vaccinated.
It's an important message, and thank you, Zach, for allowing you to talk about it with us and others, because it's such an important message for young people and for everybody, in fact, to hear. Andy, I just want to ask you again about the different approaches to some of the restrictions that went into place across the country. Going forward, as we know now, every scientist that we've talked to, that others have talked to, medical professionals say that we will face a pandemic again in the future, and our response to it should be predicated on what we learned from COVID-19 when we face COVID-26 or whatever the next thing is down the road. Would you advise going forward that restrictions, whatever they may be, are looked at on a state-by-state basis, but that is still directed by the federal government. I know that former President Trump, talked about letting the governors be in charge. But what I mean is, when you do have people that say, look how Florida performed and look how New York performed, but they don't take into account the differences just in the demographics of this city versus, Jacksonville or Fort Lauderdale or even Miami, and how we are and how this city is compared to other cities, even big cities like New York City, like Chicago. Just that the differences in states and the differences in populations and demographics might mean that masks need to be worn outside, for example. I don't know. That's not what I'm saying. But I'm just suggesting that there may be a more tailored approach going forward. Or would you recommend a top-down approach? Federal government says implementing this across the country, whether it's Montana or New York State, you all have to do it this way.
Well, I think we need is it's a really smart question, because I just lived through this in the Biden administration. What we need is a really strong partnership with leadership from the CDC and partnership with state local health departments. And the CDC was silenced, as the book goes into, and people threatened in the CDC if they spoke out over the last year. So states were left to defend for themselves and implement things on their own. And it's a hard task for states because they're not resourced for it. And some did better, and some did worse, but they all were well-intentioned and they took different approaches. And I think we should sort of strike a difference between federalism and regionalism. So federalism basically says everybody makes their own rules. In a pandemic, I'm not sure that makes a lot of sense. But the regionalism does make a lot of sense, because if you've got an outbreak in New York, it doesn't make any sense for people in Phoenix to restrict their activities. We have too big a country to do that. So we need good intelligence, and then we need to be able to allow people to go at their own pace. If everyone's going to have to stay, let's just say, spend 2 weeks away from work or school, don't make them spend 2 weeks away from work or school where they're not a threat. Wait till it comes to Phoenix. Wait till you have the right signals in place, and then say, okay, now it's here, and now's the time. But we're not going to ask more of you during a time when you don't need to do it. And that's just about getting smarter and more precise and more intelligent. You can't do that without the federal government. You can't do that without the intelligence at the CDC being able to be outspoken and working with local authorities.
Yeah, and it probably doesn't help, too, if the commander-in-chief says that he wants the governors to be accountable, but then tweets to his supporters to liberate said state that he's asked to be accountable. And so,
didn't help.
Yeah, that doesn't work. All right, Andy Slavitt, thank you so much for spending some time with us. The book Preventable is available right now. We really appreciate it. Thank you.
Thank you both.